Welcome to this explainer on the anatomy of an outbreak. Today, we're taking those standard, dry textbook models of infectious diseases and transforming them into an actual tactical playbook. We're going to decode exactly how microscopic intruders operate and, way more importantly, how we can completely stop them in their tracks. Let's jump right in. So, to start our investigation, we have to ask ourselves a really profound question. How on earth does an invisible, totally silent enemy manage to bring all of modern society to a grinding halt? It's something we've obviously all experienced firsthand, but the actual mechanics behind it are fascinating because it's not just random chaos, right? It's a highly structured biological process. All right, let's get into Section 1, the microscopic threat, profiling the suspects.
To really grasp the sheer scale of this threat, we just have to look at the numbers. Consider this. In 2020, a newly emerged infectious disease, the COVID-19 virus, became the third leading cause of death in the United States, literally right behind heart disease and cancer. That single statistic perfectly illustrates just how fast a microscopic agent can bypass our modern medical marvels and cause a massive system-wide collapse.
Okay, let's actually look at the biological intruders we're up against here. They basically fall into four primary camps. First up, you have bacteria. These are your single-celled organisms causing things like strep throat and tuberculosis. Then we have viruses, which are even tinier than bacteria, and they cause everything from the common cold to HIV. Third are fungi, often responsible for skin conditions like ringworm, though they can absolutely infect the lungs too. And finally, parasites. Think of the tiny organism that causes malaria, which totally relies on a mosquito bite just to hitch a ride into your bloodstream.
Moving along to Section 2, how diseases spread, mapping the infiltration routes. So how do they get around? Well, these pathogens essentially use two main methods to infiltrate populations. You've got direct contact and indirect contact. Direct contact requires, you guessed it, close proximity. We're talking person-to-person touching, vertical transmission from a mother to her child during pregnancy, or droplet spread, like when someone sneezes and those droplets fall within a few feet. But indirect contact, that is where things get really sneaky. This is where the pathogen uses a getaway vehicle. It might be airborne transmission, hanging out suspended in the air long after the infected person left the room. Or it could be contaminated objects. We call these fomites, like a dirty doorknob. This also includes contaminated food, water, or animal vectors, like ticks and mosquitoes. Which brings us to Section 3, the chain of infection, the master plan.
Now, what's really interesting here is this concept called the epidemiological triangle. It shows us that disease transmission isn't just about the germ all by itself. A disease only takes hold when you have the absolute perfect storm of three factors: a noxious agent, a susceptible host, and an environment that actually helps the pathogen thrive. If an infectious agent meets a host but the environment isn't optimal, the infection might completely fail. This classic triad is literally the foundation for studying any public health problem.
And that triad sets up what I like to call the ultimate heist map, the chain of infection. For an infection to actually develop, 6 specific links have to connect in strict chronological order. First, you have the infectious agent itself. Second is the reservoir, which is where the agent lives and reproduces, like contaminated water or a human body. Third, the portal of exit, meaning how it escapes that reservoir, like through a cough or a wound. Fourth is the mode of transmission, whether that's physical contact or airborne droplets. Fifth is the portal of entry into a new susceptible host, like the mucous membranes in your nose. And finally, link number 6, the susceptible hosts themselves, whose immune system might be compromised by age or other underlying conditions. Every single outbreak in human history has relied on this exact chain remaining intact. All right, Section 4, the infection timeline, the ticking clock. Even if a pathogen successfully breaches our defenses, it operates on a hidden timeline that makes detection incredibly difficult. If we compare the latent period to the incubation period, we can see exactly why these diseases are so tricky to track. The incubation period is the time from when you are initially infected to when you actually start showing clinical signs like a fever. But the latent period is the time from infection until you become physically capable of spreading the disease. And here is the absolute most crucial takeaway. The latent period often ends before the incubation period does. This creates a terrifying window where a person transitions into a highly infectious spreader, interacting with everyone in their community long before they feel sick or show even a single symptom. Let's flip the script. Section 5, breaking the chain, building the defenses. Fortunately, because we have the intruder's playbook, we can actively build our defenses. The best part about this whole chain of transmission is that because it must occur in chronological sequence, breaking just one single link causes the entire infection process to collapse. It is actually a highly vulnerable system, provided you know exactly where to aim your interventions.
So we can totally dismantle their plan using these 5 actionable steps. Step 1, eliminate the source directly by quarantining exposed individuals during that sneaky incubation period, making sure the pathogen goes nowhere. Step 2, block the portal of exit with simple respiratory hygiene, coughing into an elbow or wearing masks to catch those droplets. Step 3, interrupt the mode of transmission with strict hand washing and sanitizing surfaces. Step 4, if it's coming our way, protect our own portals of entry with eye protection or bandages over broken skin. And finally, step 5, proactively boost the host's defenses using vaccines, careful antibiotic stewardship, and just maintaining good overall health so our immune system is ready for the fight.
Zooming out a bit for Section 6, Impact on Public Health, the macro view. Mastering these defenses isn't just about an individual getting a cold, it is about safeguarding our entire global structure. When we fail to break the chain, the collateral damage is massive. Economically, infectious diseases drain incredible amounts of healthcare resources and tank workforce productivity due to people calling out sick. Socially, outbreaks cause huge community disruptions, like shutting down schools, and they often generate intense stigma against whoever is infected. And on a security level, well, pathogens absolutely do not respect borders. They disrupt international travel, they disrupt trade, and they always disproportionately impact our most vulnerable populations, like the elderly and the immunocompromised. The ripple effects are just staggering. So, taking everything we've decoded in this explainer today, I want to leave you with a quick assignment. Imagine a severe influenza outbreak hits your neighborhood tomorrow. The local health department is reporting a massive spike in high fevers and severe coughs across a totally mixed population: kids, working adults, the elderly. Using that epidemiological triangle and the 6-link chain of infection we just covered, which specific links are you going to sever first to protect your community? How exactly will you block the portal of exit? And how will you protect the portal of entry for the most vulnerable people around you? Think critically about your tactical playbook, because understanding this science is the absolute first step in ensuring the next microscopic threat doesn't bring your world to a standstill. Thanks for joining me, and keep learning.